Hi, good morning, Chris. My name is Mihira. I'm your invigilator for the OET-speaking session on the 4th of October 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Chris Harris.
Okay. What is your candidate number?
My candidate number is 313333537.
All right. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Okay. Now, let's move on to warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
How would you handle a situation where a patient was refusing to take their medication?
If a patient is refusing to take their medication, I would first try to understand why they are doing so. I would then educate them about the importance of taking their medication and the risks of not taking it. If the patient is still refusing to take their medication, I would respect their decision, but I would document the situation and make sure that they are aware of the consequences.
What is your experience with dealing with difficult patients or family members?
I have experience dealing with difficult patients and family members in my previous role. I have found that the best way to handle these situations is to be calm and respectful. I also try to listen to the person's concerns and empathize with their situation. If the person is still being difficult, I will try to politely redirect the conversation, or I will ask for help from a more experienced colleague.
What are your strengths and weaknesses as a nurse?
My strengths as a nurse are my compassion, my communication skills, and my ability to work under pressure. I am also a team player, and I am always willing to go the extra mile to help my colleagues and patients. My weakness as a nurse is that I can be a bit of a perfectionist. I sometimes put too much pressure on myself to be perfect, which can lead to stress. However, I am working on this weakness, and I am learning to let go of perfectionism.
Give me a situation when you work outside patient care.
I worked on a team that was responsible for developing a new patient education program. The team was made up of nurses from different backgrounds and with different expertise. This diversity allowed us to come up with a program that was inclusive and accessible to all patients.
What experience have you gained as a nurse so far?
I worked as a staff nurse on a general medical ward. I gained valuable experience in caring for a wide variety of patients. I also had the opportunity to shadow a nurse manager, which gave me insights into the leadership and management aspects of nursing.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hello, good morning. I am Chris, the nurse who will be assisting you here today. For verification, may I know your name, please?
My name is Mihira.
Mihira, could you please confirm the reason for your today's appointment?
Yes, I am scheduled for a colonoscopy.
Thank you for your confirmation. Do you have any concerns about the procedure?
Yes, I really wonder, what is the function of the procedure?
No problem, Mihira, I will explain it to you. A colonoscopy is a medical procedure that involves inserting a thin, flexible tube with a camera to check the health of the colon and rectum. During a colonoscopy, doctors can identify and diagnose conditions like colon polyps, colon cancer, and inflammatory bowel disease. This procedure is safe and effective for detecting these issues. Additionally, colonoscopy can help in planning surgeries or treatments, if any problems are found. Overall, it plays a crucial role in the early detection and management of various colorectal health issues.
Okay. And nurse, how the procedure is done?
Mihira, let me explain how the procedure is performed. A colonoscopy is a test that allows the doctor to see inside your colon and rectum using a thin, flexible tube with a camera at the end. The tube is called a colonoscope, and it is inserted through your anus and gently moved along your bowel. The camera sends images to a monitor, then the doctor can watch. This way, the doctor can check for any problems or changes in your bowel. A colonoscopy can help diagnose these conditions and also treat them by taking samples or removing polyps during the test.
Well, nurse, I'm a little nervous. I've heard that it can be uncomfortable.
I understand your concerns. A colonoscopy is a very safe and effective procedure, but it is normal to feel a little nervous. I can assure you that we will do everything we can to make the process as comfortable as possible.
All right.
So, let me explain what to expect during the colonoscopy procedure. First, you will be given a sedative to help you relax and make the procedure more comfortable. Then, a colonoscope will be inserted into your rectum and advanced up the colon. The camera will allow us to see the inside of your colon and rectum and look for any abnormalities.
Okay, I got it. By the way, nurse, is it really necessary to have the procedure?
Mihira, I understand why you asked me this question. I can understand what you are going through. I would like to talk to you about the importance of the colonoscopy procedure. Colonoscopy can help us to diagnose gastrointestinal conditions, such as inflammatory bowel disease and diverticulosis. During a colonoscopy, we can look for polyps, which are precancerous growths. If we find any polyps, we can remove them during the procedure, which prevents them from developing into cancer. So, as you can see, colonoscopy is a very important test for early detection and treatment of a variety of gastrointestinal conditions.
Yes, I got it.
Mihira, colonoscopy is a very important test for early detection of colon cancer. Colon cancer is a very treatable disease when detected early, but it can be deadly if detected late. In addition, colonoscopy is very accurate and reliable procedure. The risks of colonoscopy are very low, and the benefits far outweigh the risks.
Okay, I understand the importance.
Mihira, if you have any questions or concerns about colonoscopy, please do not hesitate to ask me. I am here to help you understand the procedure and make sure that you are comfortable with it.
Sure, I will.
So, Mihira, do you have any other questions or concerns?
No, I think that's all.
Great. So, do you consent to having the colonoscopy procedure performed today?
Yes, I consent.
Thank you. I will now go and prepare for the procedure. I will be back to take you to the procedure room shortly.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihira.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.